Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on progesterone tablets, exploring the various aspects of progesterone, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of progesterone tablets. Progesterone tablets are prescribed for various medical conditions, primarily related to reproductive health. They are used to treat menstrual disorders such as amenorrhea and abnormal uterine bleeding due to hormonal imbalance. They are also employed in hormone replacement therapy for menopausal symptoms and to support early pregnancy in women with luteal phase defects or a history of recurrent miscarriages. In assisted reproductive technology procedures, progesterone helps in preparing the uterine lining for embryo implantation. Next, dosage of progesterone tablets. The dosage of progesterone tablets varies based on the condition being treated. For amenorrhea, a common regimen is 5 to 10 milligrams daily for 6 to 10 days during the latter part of the menstrual cycle. In HRT, doses range from 100 milligrams daily to 200 milligrams taken at bedtime. For luteal phase support in ART, doses can be 200 to 400 milligrams daily, administered until 10 to 12 weeks of pregnancy. It is crucial to follow a healthcare provider's specific instructions, as dosage can differ based on individual needs and response. Next, mechanism of action of progesterone tablets. Progesterone is a hormone that plays a vital role in regulating the menstrual cycle and maintaining pregnancy. Its primary mechanism involves binding to progesterone receptors in the uterus, leading to changes in the endometrium that prepare it for possible pregnancy after ovulation. Progesterone also modulates the immune response to allow embryo implantation and suppresses uterine contractions to maintain pregnancy. Next, side effects of progesterone tablets. Common side effects of progesterone tablets include headache, breast tenderness, bloating, mood swings, and dizziness. Some women may experience gastrointestinal issues like nausea or constipation. Serious but rare side effects include blood clots, severe allergic reactions, and liver problems. Long-term use can increase the risk of breast cancer and cardiovascular issues. Next, important advice for using progesterone tablets. Before starting progesterone tablets, inform your healthcare provider about any existing medical conditions, especially liver disease, blood clotting disorders, or a history of hormone-sensitive cancers. It's important to adhere strictly to the prescribed dosage and schedule. Do not discontinue use abruptly without consulting your doctor, as this may lead to withdrawal symptoms or a return of the underlying condition. Regular follow-ups and monitoring are essential to assess the therapy's effectiveness and manage any adverse effects. If you experience severe side effects or signs of an allergic reaction, seek medical attention immediately. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using progesterone tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.